So thanks, everybody, and thanks for the invitation to speak this afternoon. As I think was articulated in the agenda, I'm going to talk about how to think about this problem of obesity or the problems of obesity and chronic disease prevention from a systems orientation or a systems framework. And so let's go. Now, since it is the after lunch portion of your day, I'm going to give you the take-home messages now in case you choose to have a little nap in the afternoon. So hopefully this will ground you and maybe excite you enough to stay awake, so we'll see. So the first point I want to make today is that chronic disease prevention, or obesity, I tend to use them interchangeably, and I know there's going to be dialogue later about the framing of this, but for the moment I'm going to use that language interchangeably, is complex. And it's not just simple or complicated, it's actually complex. And I'm going to make that distinction for you, why I want you to think about it in that way. The second point I want to make is, hopefully, there we go. I want us to start with that notion that it's complex, accept the complexity, and then think about what that means in terms of solutions. So it doesn't mean that we need to turn away in despair, but there actually are solutions appropriate for complex problems, and that's really where I want to talk to you, what I want to talk to you about today. And then lastly, there are a number of different implications of solutions or types of solutions for complex problems, and I'll speak to you about a few of those. I'm not sure I'll have time for all of the ideas that I'd like to get across, but we'll do at least a couple of them, okay? So that's where we're going to go today. That's the map. Now, the first picture I want to show you is this one, which begins by articulating obesity in the way that most people know about it, which is it's about energy in and energy out, and the simple solution is to eat less, move more. We all know, I'm sure all of you know, that it's not that simple. And it's not that simple because there's a whole host of factors that actually affect your food and physical activity related behaviors. And I like this particular diagram. This is the International Obesity Task Force causal web diagram. I like it because it helps you see that these factors are in sort of layers, in a sense, proximal to you, very close to you, like factors in your home, school, and work life, things that affect your availability for leisure time activity, or there's all different kinds of things like that. There are things that are a little bit further from you, so in your community and locality, in your region, or even in your nation. And we'll come back to this a little bit later to talk about interactions. But nonetheless, it layers things in that way. And you can kind of see and imagine how there are things like transportation policy, which affect your access to public transit, which affects your ability to be physically active in your commute to work, those kinds of things. You can begin to imagine how some of those factors might be important. But I don't like this picture because it's very linear. It argues and suggests that all of these things act on you, the individual, and it really doesn't show any of the interdependencies that exist. Instead, I really like this picture, which is the obesity system map. How many people have seen this map before? Okay, so not all of you, but a few of you have. And what I really like about this map, and what I usually say about it, is I like it because you can't read it. And so, we don't have to zero in on the intimate details of the map at the moment, but recognize that there's a lot of complexity to the problem of obesity and chronic disease prevention. And so what I like is that the map focuses you on those interdependencies, on the connections between the variables, not so much on the variables. And I might refer to this later as the spaghetti and meatball diagram. That tends to be the way I think about it. But it really conveys the notion right up front that the problem is complex. And there actually are specific characteristics of complex systems. And this is a list, and we don't have time to actually work through the list, but I thought I would illustrate to you that problems that are simple or just complicated have certain kinds of characteristics, and it's not a black and white, but there's shades of gray there. And problems that are complex have somewhat different characteristics. So if we were all homogeneous in this room and all had the same exact caloric need or did the same amount of physical activity, it'd be probably a fairly simple problem to figure out a way to get us to eat less and move more. But we're not homogeneous. We're very heterogeneous. We have different biological predispositions and all kinds of other things that affect us, and that makes the problem more complex. Likewise, there's all kinds of other characteristics, the nonlinearity and the relationships between the variables in the previous map, the interdependencies, the fact that it's dynamic, the fact that our life history is important in where we're at today, that there are different kinds of adaptations and self-organization that are important. And in many ways, I like to say that obesity is the emergent property from all those relationships that exist, okay? So that's how I want to frame the problem as a starting place. But say that, the common responses, unfortunately, to complex problems are retreat, despair, believing the problem's beyond hope. And maybe that you're feeling this a little bit after seeing those pictures. Assigning blame, that's a really common one. Simple solutions, we're going to have a simple solution to fix this complex problem. And occasionally it's to galvanize our collective efforts and invest significant resources. Now, I've been using this slide for a few years now, and when I first started using it, I sort of said, well, I think that's where we're at. I keep saying, I think that's where we're at, galvanizing our collective efforts, and I'm still waiting for the proof in the pudding, but there is some movement in Canada towards an FPT framework and maybe some action at the level of government. So these are the common responses, but there actually are much more useful responses to complex problems. So I want to talk about, if I can do all four of them, I will, but if not, we'll just talk about 3 of these ideas or 2 of these ideas of places to look for solutions when the problem's complex. And these are kind of generic ideas that fit across complex problems. And you may be able to apply them to other complex problems you're struggling with or that you're trying to understand and think about. So the first one is that there's an important relationship between the levels. So I showed you those different levels, and we'll talk about this in a second, close to you, in your community. And it isn't the individual variables in those boxes that I think is as important. It's the interaction between the variables that are important. And we'll talk about that just briefly in a second. The next thing that's important is that the relationship between, so individuals still matter in a complex system. You see all those variables and you think, well, maybe we just need an ecological approach and it's really just about, changing the environment. And there's lots of dialogue about that, and certainly that's an important component. But what's really important is that we think about the individual, because individuals still matter, be it the individual who might be struggling with weight loss or changing their behavior around weight, or the CEO of a food company who's trying to balance the interests of the shareholders in that company versus trying to do the right thing to create a healthy food supply. It's about the complexity of the task each of these individuals has and their capacity to deal with it. So we'll explore this idea a little bit more, but that matching of capacity and complexity I think is enormously important. There's an interdependence between competition and cooperation, and I'll illustrate that as well. And I think this might be an idea that if we can figure out how to use it, could be very helpful in developing solutions. And that, again, is kind of about interactions. And lastly, if we can talk about it, we'll talk about how you can influence the emergence and maybe shift the emergent property of our complex system now, which might be obesity, to one in which the emergent property is health. Okay, so levels. So that other map showed you there's these kinds of levels and more. I mean, if you want to go all the way down to the genetic level and the protein and organ system level, you'll hear a bit more, I think, about that from our second speaker, Linda McCargo, who's going to talk about metabolism and metabolic flexibility. And then from the individual going up, there are these other levels. So this is one way to think about levels. And the important point I was trying to say is it's about the interactions between the levels. So let's look at this map and think about it, for example. It's not public safety by itself that's important, for example, in determining obesity, but it's the interaction between public safety and how we might spend our leisure time physical activity, and whether or not we feel safe to go out of doors to actually engage in that activity. So it's in those relationships between the levels that we need to look for both potentially the problems if we want to focus on that, but more importantly, to find the solutions that might change the environment and change the way we operate. But levels come in different sizes. So we talked about the kind of standard ones about home, school, work, region, nationality. But I spoke to a group of dietitians and nutritionists at McGill recently, and I started to think about the complexity of diet information, for example. And so this is kind of a scaling of that. At one end of the spectrum, we talk about food and what you should eat on the basis of its nutrients. And so we take food and break it all down into its nutrient components and then create advice advice for people that is based on that nutrient content and what we know about how that impacts health. In some respects, that really is the most complex way to represent the information, because the number of possible combinations of ways to think about it and to describe it is really large. Whereas if you're simply talking about food in terms of whole foods, more like we tend to do in the food guide, or even in the form of meals, as the US government has now put out their dietary plate version of the food guide. We're starting to sort of integrate, and then you have less, in a sense, different ways to describe what to eat. And at the top of that might be accumulated dietary intake. So just to explain this one step further, we have different paradigms that drive how we talk about food, and therefore speak to the complexity of trying to talk about food and give food messages. At one end of the spectrum, we have our nutrition facts panels, which have tons of information, and then we have to support that with all kinds of information about how much you should eat and what should be the recommended daily intake and how much should it be in a particular meal and stuff like that. And at the other end of the spectrum, we have Michael Pollan's 7 words: eat food, not too much, mostly plants. And it's just to illustrate that those are two really different paradigms to think about how we message about food. But if you're the target of that message and you're receiving that information, well, those 7 words are pretty good, actually, when you think about it. And if you understand what he means by eating food, food, I think he defines food as having no more than 3 ingredients on the list. And if you think about it, that's pretty good advice. And if you live by those 7 words, you probably have a pretty healthy diet, particularly because he includes the not too much part of it. So I think we really have to think a lot about the challenge that we've created by having such complex messaging with respect to food. And certainly, it's easier for me to remember Michael Pollan's advice than it is all the details I might actually need to know. So if I have to remember those details, it's a pretty complex problem for me. Another way to think about levels is related to the intervention. And this is, I don't expect you to sort of walk all the way through this, but this is 12 levels of intervention that were described by a systems thinker called Donella Meadows, who worked in the area of the environment a number of years ago. And at the top of the list are the things that are the hardest to change, but in fact would be the most effective to change. And at the bottom are the things that are easier to change, the kind of fiddly bits, as I like to refer to it. Now, 12 levels is too much. So we started to explore in my research group how we could use these levels to think about what it is we really need to do. And we're in the midst of doing that, but we first realized 12 was too much, so we collapsed it to 5. So this is a little bit easier to digest, I would say. At the top here, the paradigm. What are those deeply held beliefs that drive what we do and what our goals are? And I gave you just one example of that deeply held belief that you need to break food down into its nutrient parts in order to provide good advice. That's kind of a paradigm. Versus, simple messaging that's kind of integrative might be more useful. The goals of the system are what it's trying to achieve. The structure might be, when you think of the spaghetti and meatball diagram, think of all those lines that you saw, those interdependencies, and what are the things that might be important across all of those interdependencies, like maybe the level of trust in the system that affects how functional those connections are. Certainly, it was hard to see in the picture, but there are lots of feedback loops in that diagram, so things that can either reinforce behaviors because A leads to B, B leads back to A kind of behavior, and ones that actually help to balance it out because A causes B to go up, but B causes A to go down, that kind of an idea. And lastly, there's all those fiddly bits, all the things you couldn't read in the diagram, the variables that were there. Those might be related to actors in the system or variables that are relevant. And if we're working at that level, we're only dealing with a small part of the problem. And I'm not saying that you shouldn't do that. In fact, we will need to do that, but how much of that we need to do is also an important question. So let me apply it to the problem at hand. So the paradigm I think that we're currently working under is one that suggests we need simple solutions. And the other paradigm that many of us work under, certainly researchers do, is this challenge that in order to figure out how to solve a problem, we have to work out all the causes, reduce it to its component parts, and then put it back together. And what I would argue is that strategy is a waste of time. I'm not sure that we need to pin down the causes of the problem. And when we do, the methods by which we try to pin them down are really only isolated in a sense from the whole system. And when you try to put the system and watch the system function in its entirety, well, in fact, what you learned by controlling it and figuring out that causal loop may not actually apply. So I think we're wasting our time actually doing that. Our goals currently are to do things like increase physical activity, have healthier dietary habits. Maybe a goal should be in increasing the health of the food supply. Our structures are pretty siloed, I believe. Like the domains of research and evaluation are separate. For years I asked the question, what's the difference, and never got what I considered a satisfactory answer to that question. I think they're different ends of a spectrum, and I think we need to bring those worlds closer together in order to get better learning from what we do. Our government, private sector, NGOs, there tend to be big silos there, and I've been doing some work I'll tell you briefly about trying to build trust. But those are the kind of where we're at. Where do we want to go? Well, I think we want to accept complexity instead of think of simple solutions, and we want integrative approaches. We want to, and I'll explain this a little bit more in a second, increase people's capacity to deal with the complexity of their environment and decrease the complexity of their environments. And that's an important litmus test, I think, for anything we do. Does it increase people's capacity or decrease the complexity of their task? In terms of structure, we need a bit more coherence and connectivity. We need greater trust across sectors so that we can work together, because there's so many different elements to this problem. We need to be able to collaborate across that. In terms of that lower level, I think we'll go quickly here, but feedback loops are an important component of this, and we need to think about and figure out, and I've got a student working on this, how do we help people think about feedback loops that you could create that will shift the dominance or the balance in the system? So it sounds a bit theoretical, but we have some practical ideas going on there. And lastly, most of the things that you're thinking about, I'm guessing, and that we think about in general, and that we have evidence for, are the structural elements. They're the fiddly bits. There are things like health education and social marketing and food labeling schemes and a whole variety of the interventions. And I'm not saying we shouldn't be doing these, but we need to understand where they fit in the scheme and understand the higher levels of intervention. And certainly we need to do a variety of other things as well. So how many of you do evaluation in your work and do interventions and do evaluation of it? Not a few of you. Okay, so just quickly, this is kind of, right now where we're at is paradigms for research and evaluation that are about reductionism, I've said that already, and about accountability. If we get money from somebody, we need to account for that money. We try to attribute, what caused what to happen. The structures often that we're working with are disconnected. I often say feedback is indirect and glacial, particularly if you're working with government. And structural elements, they tend to be somewhat mismatched. And where we need to go is to a system that supports learning, where learning is the agenda, not accountability, where rather than worrying about attributing A caused B, we want to know if we do an intervention in our environment, what adaptations are we allowed to make and still have the intervention be viable and effective, and what are the things that we need to pay attention to when we're trying to do that adaptation. We want, of course, to build interdependencies and have more continuous feedback systems and have our things function more coherently. So I think those are different levels of intervention as well. Now, we did some work in my group trying to say, let's look at, and we're continuing this work with some CIHR funding, what is it that we can do and should be doing? And there's lots and lots of documents out there making recommendations. And we did a little bit of sorting of them into these levels. And the reason I show you this, it's a bit, this is just one example of it. But so we think a little bit about paradigms and goals, a lot more about structure. We don't know how to think about feedback loops and how to make recommendations in that area. So that is a problem that we're working on. But most of the things that we think about are at that lower level. And this just illustrates maybe the distribution that we think about it, but it might also imply this is maybe the kind of distribution of time and energy and resources that we should be putting into each of these levels. And it suggests to me that there's probably a gap when it comes to feedback loops. So as I said, one of the things we're working on is how to do that. Okay, I'm going too slow, so I need to move a little bit. In terms of the relationship between individuals and organizations, how can we deal with the complexity of our tasks? So this is the idea that I was referring to before. If you as an individual have tasks that you face, be it managing your weight or managing your practice or whatever it is that you do, if the parameters of that world that you work and live in are more complex than you have the capacity to deal with, and capacity, I'm talking fairly inclusive of different things that affect our ability to actually manage our world. So it's not just intellectual capacity, but maybe you don't even have the resources. So think of these ideas as generally. If the complexity of your task is greater than your capacity to deal with it, you're going to fail, right? That just makes intuitive sense. So we need to make sure that when people are faced with choices and tasks, that their capacity is well matched to the complexity of their environment. And the reason I think that's important here is because it gives us a couple of options when we think about what our interventions are. We want to increase people's capacity, and I think we assume that health education will do that. I'm not so sure that we ever measure how it really affects people's capacity or whether it does have a big impact. Or we want to decrease the complexity of people's environment. And this is an area where I know we really don't think a lot about how to do that. And sometimes we come up with ideas like giving people more choice, which actually is just increasing the complexity of their environment. And if we don't take choice away at the same time that we're giving new and healthier choices, it may not be any easier for the person to operate in their world. So, the example, food labeling environment, this is a very complex environment. It's no surprise that people make lots of mistakes and don't necessarily successfully navigate the food labeling environment. And this is just illustrative to remind me to talk to you about it. We know that people use a whole variety of sources of information. This was from the Food and Consumer, or the CCFN actually's nutrition survey. But it shows that, in fact, the things that people rely on are product labels, are magazines and newspapers. And interestingly enough, there's kind of a disconnect in this diagram between the trusted sources and the less trusted sources. So the most trusted sources are the ones at the bottom that people don't use very much, things like nutritionists and dietitians. And the least trusted sources, like the food labels, and when you ask people the question, they don't necessarily trust them. Those are the ones at the top that we use. So if you think about that, we've really made it quite complex to navigate the food messaging environment. Now, how do we cope with complexity? What do we do as individuals when we're overwhelmed by complexity? Well, we tend to eat mindlessly. This is Brian Wansig's idea. And when you think about it, he argues, and he's done some work that shows that we make more than 250 food-related decisions a day. Well, if you made those all mindfully, you'd spend your whole day thinking about what you were going to eat and navigating your food environment. So we have to make them mindlessly, meaning we don't think about them. We just take either the default position, which is often very common. We tend to trust in brands that we're comfortable with. So these are ways in which we cope with that complexity. We often make contextual decisions. I was just illustrating this for somebody earlier. How often have you been at a restaurant where you couldn't decide what you wanted to eat, so you asked everybody else what they were eating, and then it was much easier to figure out what you were going to have, right? It's pretty common, right? That's because it's easier to make a decision in context. And we also do things like anchoring, which is a tendency to follow what we did before. So it's much easier to default to, well, this is what I always have at this restaurant, and I'm not feeling very adventurous, so that's what I'm going to eat, and so these are the ways that we cope with this kind of complexity. So I think we need to think about new tools that we can actually use to help people navigate the complexity of their environments. And if it's navigating diabetes treatment, these cards are related to diabetes, but I'm going to tell you briefly about a set of cards we've created to deal with obesity. So I saw this idea a few years ago in the UK. A design council developed this deck of cards in collaboration with people who have diabetes. So you see patient-centered statements on there like eating away from home is tough, or I don't like to take my medication, or things like that. And there were 40 cards, which represents essentially population level complexity. And the real goal here is to take something without talking about the word complexity and say, okay, so this applies to a population of people. What applies to you? Pick out the cards that are meaningful to you. And then when you go in to talk to your healthcare provider, you can say, well, here's the ones that are meaningful for me. Immediately you have a conversation. You can start with that provider. And then the provider can help you say, well, okay, so this is still a lot lot to deal with. Maybe we should zero in on one. The other things don't go away, but here's a place to start and to navigate the complexity of that environment. So we spent the last little while developing a set of cards that represent obesity or the challenge of weight loss. And these cards were generated using the Foresight map that I showed you earlier, and are all the domains of that map. This is just a subset of the cards. This just illustrates that in our first round of testing of these cards, it's roughly normally distributed how many cards an individual picks, with the mean somewhere between 20 and 30, something like that. So the people who were interviewed and did this study, there's still a lot of issues that they're focused on and dealing with. And you can't read this, and it wasn't really intended, but it's intended to illustrate to you that, so this is all the cards lined up from 1 to 64. You can see the domains at the bottom that are relevant to the Foresight map. But the point being that some things don't bother too many people at all. Some things are concerns for a lot of people, because there were 18 participants, so you can just sort of gauge against that. And some things bother some people, and some things bother other people. And what we found with these cards and the diabetes cards is there's no two people alike. So we have to remember there's tremendous heterogeneity, and you can't just have a one-size-fits-all solution for those individuals. So that's a quick recitation of that. I'm just gonna talk really quickly about this idea of interdependence between cooperation and competition, and then close from there. So the idea is this, and this is really easy. I suppose I should have a Canucks picture on the slide today, but the most competitive teams in a league are the ones with the most cooperative players. So if we set a competition at one level and we think the level below that, we're going to get cooperation. So the idea is this: competition between teams creates motivation to have cooperative players, okay? And cooperative players make that team competitive at the step up. So that's the idea. Now, how does this apply to obesity, to chronic disease prevention? Well, in the UK, one of the things that they started to do was try to ask the question, well, so where are there different parts of government that play a role in particular areas, and how can we get them to cooperate with each other? And I apologize, the picture is kind of bland because when it was given to me, it had the labels of all the government departments that were relevant to each of these regions, but I was told to take it off because it was a stakeholder engagement group. Not that you guys would recognize any of the acronyms showing the picture here, but the point being that different ministries in government play a role and overlap in those roles for different variables in the map. So how do we get them to cooperate? Well, in BC, actually, we did this under Act Now BC. It came and went pretty quickly, but it was a very innovative idea, which was the government, the British Columbia government, put money into an incentive fund that required ministries other than health to cooperate with health to develop ideas and programs that would actually promote health. And so you got transportation and health and other ministries cooperating with each other for innovative projects because they had to compete for that source of funds at the level above them, and it required cooperative teams. I think we need to think harder about how to do this in our healthcare system and in our public health systems. Okay, I think I better skip this because I want to leave time for a couple of questions. But well, let me just quickly say that I think trust is really important. We've been doing some work in this area to try to build trust. These are the logos of organizations that have helped support our building trust work. We've had several meetings, and I think this is important because I would think of it at that level of the system. It's an important system variable. Trust, if you work in a high trust situation, it's not as complex. If you're in a low trust situation with the people you work with, it's more complex. So we need to reduce that complexity. And we've learned some interesting things through this initiative. Regulations needed when you don't want companies to compete. So if you want to level the playing field, this is where regulations needed. And it was somebody from a food company who explained this to me. So I think when you're in a trust situation, you can learn some things about how the system needs to operate. Trust is hard between sectors, but it's actually harder within sectors because we all compete with each other, right? So I compete with other academics, NGOs compete for other donor dollars with other NGOs, government, you compete with other ministries for dollars. So it's actually harder to do within your sector than between sectors. And we need a safe space to do that, and that's what some of that work has been doing. So I'm going to skip the influencing emergence, although I think it's interesting. I will actually just quickly make the point that to influence emergence, this idea is a nice one to take home. We know we need to act locally because these problems vary from location to location, and those of us who work in a local environment have the most knowledge about how to change those environments. So we need to act locally, but we need to connect regionally with people in order to experience and learn from them, and then we need to learn globally because we can learn across a system. So that's an idea that I think is quite important. So I'll skip that and just come back to my take-home messages and say that hopefully I've convinced you the problem is complex, but that complexity doesn't mean you need to throw up your hands and go away. That complexity means that there are some solutions and approaches that are more appropriate for complex problems. They're not the ones where we try to work out how A leads to B leads to C, but they're taking some of those general principles and trying to find ways to apply them. And that the interactions between levels and between competition and cooperation and between capacity and complexity are the things that are really the most important. And I'll just close by thanking my gang, many of which are here today. I do have both my research lab and some work that we're doing to try to create a system to support practice-based evidence collection, sharing, and use, and that's the Capture Project. And these are some of the folks that were with me last summer and some of the ones that were involved in the stuff I told you about. So I hope I haven't gone too far over. I'm looking at my clock and realizing, oh, but I started late, so I probably have time for a few questions. Is that right? Good. Thank you. So, questions. And I apologize that I can't be here for the panel discussion, but my flight leaves at 6:15, and I'm a nervous, traveler to the airport type. So, any questions? No? It was that clear? Oh, there behind you, there's a mic.
Diane Sue Ross. I really like your cards example in terms of explaining the heterogeneity. Have you used them at different levels? Like, would you ever think of developing those kind of cards in the mix between government and food, et cetera?
That's a great question. And I haven't ever thought about using them with government. What's the complexity of their environment? It's a really interesting idea. So this, we've been thinking about the idea for a long time, but I'm pleased to say that one of my master's students who's just graduating just finished the study that I was showing you the data from. So it's our first attempt to create a deck for obesity and to begin to explore its use. We've always thought about it as a useful tool primarily at the level of an individual with their healthcare provider, because it's kind of a communications tool that quickly gets you from, here's a person in front of you who you don't know anything about, to, oh, here's a person who I know at least what they feel their issues are, and we can begin a conversation in that regard. I have some colleagues at the University of Alberta who've been developing cards for children, and I can't remember exactly whether I think it's not between families and the kids, but I think it might be between healthcare providers and families. And we're also contemplating developing a new deck of cards, maybe for communication between families, parents, and children who are seeking treatment, because some of the preliminary work my associate Carrie Madison has done suggests, they're not necessarily on the same page about what the issues are, and so it may be very useful to have a deck that would allow them to have a conversation between each other, say using the deck and sorting it separately and then talking about how it looks together. So that's an area that we'd like to explore, and Carrie actually is going to sit in on the panel for me, so if you want to explore that a bit more, you can ask her some questions. But it's an interesting idea about using it at the policy level. I'm having a tough time thinking about how that might actually play out and what would be on the cards, but it's certainly worth thinking about, for sure. Yep.
Hi, I'm Ramona Josephson. Thank you for an excellent presentation. Clearly, obesity is very complex. And my question to you is, I see that you're on the board of the Canadian Obesity Network, and I wondered, based on that, what the complexity was of the stakeholders in that network, what role we as dietitians play, and how we may be able to get involved in the network in a more active way than perhaps we already are.
Sure. So 2 quick things. One, the map that I showed you wasn't generated by the Obesity Network. It was generated in the UK by a fairly multi-disciplinary stakeholder group, although I didn't show you today a map that we kind of zoom out on, and it suggests there probably weren't too many people from the food industry involved when you look at the results of it. But in terms of the Canadian Obesity Network, it is a very multidisciplinary network. Anybody can join. In fact, I think registered on their website are about 5,000 people now. It's quite a large group, and it's by no means any one disciplinary background. I think there are many healthcare professionals in the dietary area, in physical activity, clinicians, researchers, a whole variety of folks. I think it is a great place to actually get involved in Canada because it is a good way to meet your colleagues across disciplines in Canada. They just had their second obesity summit. They have them every other year, and it's a pretty interesting meeting, much better than the scientific meetings in the US because it is more multidisciplinary. So I would certainly encourage people to check out their website. They have a lot of video footage from lectures and stuff like that. I spoke at a weight bias summit earlier in the year, for example, and they have all the speakers from that summit. So if you're interested in that topic, there's a lot of good content there. So strongly support it, and they are moving in the direction of also trying to do more, both for healthcare providers in terms of education, and they've collaborated with Dietitians of Canada, for example, on courses, as well as for the public, and they're really pushing in the direction of trying to develop credible information for the public when they're trying to assess options in terms of things like weight loss and stuff like that. So hopefully that answers your question.